The broadcast is now starting. All attendees are in listen-only mode.
Good evening. Welcome to our third in our webinar series on graduate education and advancing your health careers. I'm Jeff Oxendine. I'm the founder and president of My Health Career Navigator, and it's my pleasure to welcome you to this webinar. Tonight we have a really exciting panel. We're going to be focusing on dual degrees in the health field. As we've talked about in a couple of our previous webinars, that given the types of change and solutions that we're approaching now in the health field to really improve population health and improve the efficiency and the quality of our health organizations, that dual degrees are a really important way for you to get the knowledge, the skills, the credentials, and the relationships that you need in order to really be an effective health professional. Tonight we're fortunate to have three people who have graduated from dual degree programs and are working in the field. For those of you that are Health Career Connection alums, these are all three HCC alums that we're very proud of. The first leading us off tonight will be Oliver Chu. Oliver has an MBA and an MPH from UC Berkeley. He is a consultant with Deloitte and Touche. Prior to coming to graduate school, Oliver worked, actually has a nursing background and worked as a nurse at UCLA Medical Center. Also had worked for Kaiser Permanente and some other kinds of hospital administration roles. We will also have Rosa Doe. Rosa is the program manager for Care Innovations with the Center for Care Innovations. And Rosa has a master's in city and regional planning and master's in public health. As we've talked about in previous webinars and in our blog, really the focus on improving health now is on improving place-based solutions, building healthy communities. And to have city and regional planning combined with public health, it's a great combination in order to do that. And then we have Sunny Bernard. Sunny has an Master in Public Policy and Master in Public Health, and recently graduated from the School of Public Health at Berkeley in this past May. He worked for UC Berkeley over the summer and is now actually working with My Health Career Navigator and as a consultant. So with that, I'm going to turn it over to Oliver. What we will have is an opportunity for you to ask questions, so please type in your questions. Sunny Bernard will be facilitating the session from this point forward, so please ask your questions and really get the most out of this session. I just want to thank the panelists and also thank you all for joining us. There are other webinars coming up in our webinar series that Sunny will talk to you about, and please review our past webinars. That we've had one on graduate school preparation and last week on health administration degrees, and then we have webinars from last year on graduate education preparation and then your job search. So with that, I'm going to turn it over to Oliver, who's going to lead us off.
Jeff, thank you so much for having me here, and it's an honor to be able to speak a little bit about my career and a little bit about the dual degree options. I know I'm one of three other panelists, so hopefully, you can get a lot of good information from this, and don't hesitate to kind of reach out to me as I can help you with your decisions and your career. But a little bit about myself, as Jeff had mentioned, I did get my MBA and MPH from UC Berkeley, and getting a dual degree as opposed to a non-dual degree was a great decision for me. And everybody has their personal kind of motives, but I thought it was a great choice for me. And a little bit about my background, as Jeff mentioned, I was a cardiothoracic ICU nurse before I had graduated from the University of Pennsylvania with a degree in nursing and a degree in economics. Really wanted to spend time at the bedside to really care for patients, and I really loved it. I loved being a nurse. I realized as a nurse you can care for a lot of patients, and I saw a lot of systemic changes and systemic issues that you're seeing nowadays and you're going to see in the future. And that just ultimately led me to get my MBA and my MPH. Before that, I had a little stint in the Army and with Doctors Without Borders, doing some humanitarian aid work in South Sudan. but just seeing kind of the systemic issues going on in healthcare across the world and in the United States, I thought that the MBA and MPH program would benefit me most. The reason for that was because not only would I get the healthcare background and the kind of the technical expertise from the Masters in Public Health program, with courses like epidemiology or, maternal child health, environmental health sciences, healthcare policy, but I get the hard business background skill set to be a good manager, to be a good administrator, to be a good consultant that you would need on the MBA side, finance, accounting, statistics, marketing. And that's really why I decided to do that. It was a good choice for me, and I know that Rosa and Sunny will talk about their career decisions as well. So, being a nurse or being any, as you finish your undergraduate degree and start working, the graduate program allows you to, broaden your skill set or even narrow your skill set down to things you want to do. And so a lot of people have asked me, oh, well, you did nursing, why get an MBA? And my answer to that is that, you want to broaden your skill set. You want to learn new things. Why not get it? Why not go to graduate school and do that? So, like I mentioned, in choosing my degrees, I really wanted to kind of go into get the analytical skill set, the technical skill set to learn healthcare and to be able to go into, jobs such as what I'm doing now at Deloitte, working as a consultant, really helping healthcare systems and providers and healthcare industry companies with some of their biggest problems. And it's been a rewarding experience. I've learned a lot through it, and I've also helped provide value to the people I work with and working with a great team as well. So I'm going to I know that's a brief introduction about myself. Sunny, I know you have a few questions, or if there are questions that you want to send over, I can help answer. But that's a brief introduction about myself, and I'll let Sunny kind of take it over from here and see what I can help answer with.
Okay, cool. Thanks, Oliver. Well, one of the questions I had for you in particular is, how did you decide on Berkeley? I'm sure you had a ton of options. What drew you to the UC Berkeley School of Public Health's MBA MPH program?
Yeah, thanks, Sunny. The Berkeley MBA MPH program was, one of the top choices I had to choose from, and the reason why I did it was because it's a small program. They admit about 10 to 15 people, and you really feel like a family within the family. Both the MPH side and the MBA side, they're not huge programs. There's not like 1,000 students in each side where you don't get to know each other. It's actually a very small program on both sides. And then when you're in that MBA and MPH program, it's with 10 to 15 people, you get to know people really well. It's a family within a family. The other thing I liked about it was that it was a well-structured program. A lot of times these dual degree programs, they'll make you take all the business course prerequisites, they'll make you take the MPH prerequisites, and basically you're taking 4 years of study into 3 or 2.5. Well, the Berkeley MBA MPH program really made it well structured. All the classes were well structured. I didn't have to fight for the classes I needed to take, and I had a plethora of options of electives moving on both the public health side and the business side. And also, both of these programs are very renowned. I mean, I learned so much from not only the professors, but the students, and getting to know their passions, whether it was, creating a startup on DNA testing or, maternal and child health, how to, better prepare children and care for children moving forward. It was really exciting to meet the really different, passionate people within both programs.
Okay, a question. You mentioned that you had a nursing background. Did you feel that that was helpful for you as you went through the MBA, MPH program at all? Because like you said before, it's a little typically, well, my understanding is that most people who come into MPH programs usually come from MBA programs, typically come from a business background. So my question is, do you feel that that nursing background helped you in graduate school?
Yes, I would say that and this goes out to everybody, anything that you do maybe that might be now out of the ordinary or kind of different for the program you're applying to, use it to an advantage. I mean, yeah, folks in my MBA program or even my MPH program actually were like, oh, you're in nursing, how does that tie? And in the work that I do now with Deloitte, it's really helpful because I understand the clinician's point of view, but I also have the business background and the technical expertise to kind of go hand in hand to be a hybrid. And it's been really helpful talking with both clinicians and business folks in hospitals, knowing that I have this background and I have this expertise to offer. So that goes for you guys as well. If you don't, if you think you're kind of, out of the norm with whatever program you decide to apply to, use it as an advantage and learn, and people will learn from you as well.
Okay, and we have a question for you from, let me see, from Erica, I believe. She said, would you be able to talk more about your experience in South Sudan, how you got involved, and how that impacted your decision to pursue a dual degree?
Yeah, definitely. So I was working as a cardiothoracic ICU nurse, working with heart transplants, and at UCLA, one of the top-notch, technologically advanced kind of practices in healthcare. And I've gone on missions trips before, and I really, in my heart, wanted to do something a little more longer term and go to areas where people needed it the most. I went to a Doctors Without Borders, seminar. I really researched the programs and realized that it was an organization that I wanted to be a part of. So, once you apply, they don't tell you exactly where you're going to go. They kind of, whatever opens up, and South Sudan happened to open up at that time. So I spent a year there working in the Nasir kind of city, which is in South Sudan. And I really helped with, working in a hospital, and if you can, call it that, it's very different from the hospitals here in America. I was in a little village called Benishoa where I was doing things that I hadn't done before, but really saving lives that I know, like, I was helping deliver babies, vaccinating children, treating children for malaria, and really realizing, if I wasn't there, I think that child might have died. Like, the kind of thrill you get from, like, thrill is not the right word, but, being able to save lives and doing that was an exciting experience. And I realized that even with organizations like Doctors Without Borders, they need the kind of the business acumen or the analytics to be more successful and to help more people. I remember when I was in Sudan, this is a short story and I'll finish up, we were doing an analysis. We were trying to build a clinic that can sustain kind of the storms and the rainy season that they had in Sudan. And we were using kind of local products to build the clinics. It was, and we, I thought about it more. I was like, maybe we can fly metal sheeting from Kenya, and build a clinic that will last 5 years. And at first, my manager or my folks down in Amsterdam and everything kind of laughed at me. They're like, fly metal sheeting, you know how expensive that's going to be? But, I kind of, we didn't have Excel, I didn't have a computer like over there. So I, did a little sheet, did the cost, said actually, over the long run, it's going to be cheaper to to fly metal sheeting and build a well-to-do clinic where, mothers can deliver children, babies can stay, and, it's not going to get blown over or rained over. And so we did it. So over the course of a couple of weeks, we flew some metal sheeting, we flew a clinic, we flew some wood, we flew supplies over, and we built a clinic. And from what I know and what I remember, the clinic's still there working and being able to treat. So even across, in the middle of somewhere remote, those kind of skills and that analytical ability will be useful along with kind of the nursing and the educational health, the population health that you also do with the MPH side as well. So that definitely contributed to one of the reasons why I decided to do a dual program.
Okay, one last question for you. Typically, MBAs, I've been told that you usually have to have work experience. right after undergrad. So I guess like my question for you is like, how long did you work before you decided to come back to school?
Yeah. So I worked a little over 4 years before I went back to school, but that's my path. I know folks who worked 1 to 2 years. I know folks who worked 10 years. And I've known folks who worked even longer. For me, and for I guess my advice would be to, when you feel that you're ready, when you feel that it's the right time, make the change. Don't feel like you have to go at year 3. Don't feel like you have to go at year 2. You may have some colleagues who may be doing who may go to business school in 2 years. Just feel what's natural to you when you're ready. When you're ready to make the move. There are plenty of other things that you have to think about. Family, geography, money. There are things that will go into your decision. So don't feel like you have to go during a certain year. Just go when it feels right for you and when you think it makes sense in your career.
Okay, well, I want to say thank you, Oliver. Everyone who's on the line right now, Oliver is calling us from halfway across the world, so it's about 3 a.m. where he's at, but he still wanted to be with us today to answer any questions that you may have. So I want to thank you, Oliver, for taking the time for being with us, despite the fact that you have to be up in a couple of hours to go to work. So thank you.
No problem, Sonny. My pleasure to help out and to help out with everybody's decision with graduate school. Thanks.
All right, take care now.
Thank you.
All right, guys, our next speaker to come up is Rosa Doe. And Rosa has a Master's of Public Health degree and a Master's of City Planning degree, one of the 6 different concurrent programs that we offer here at UC Berkeley. So we're going to have Rosa share her background and her story and why she decided to get a Master's in Public Health and a Master's in City Planning and what she's currently doing right now.
Thanks, Sunny. Hi, everyone. So my name is Rosa Doe, and I graduated just this past year with a Master's in Public Health and Health Policy Management, similar to the program that Oliver was in, and also a Master's in City Planning focusing on community and economic development, both at UC Berkeley. I also did my undergrad at Berkeley in public health and a minor in public policy in 2005. So UC Berkeley has a very special place in my heart. So my background, out of undergrad, I worked in healthcare quality and performance improvement. So I did an internship through Healthcare Connection in Jeff's shop, working at the Integrated Healthcare Association, really learning about how do we measure performance of health organizations and measure healthcare quality. And so from there, we partnered with a nonprofit called the Pacific Business Group on Health. So I transitioned there as a project manager for 4 years, and we focused on developing training and education programs for providers at health systems to improve chronic disease care and patient experience. And so through my experience there, I had this burning question of, why do we keep focusing on these performance measures in areas where they're kind of lagging, but understanding, what are the underlying causes of poor health? Is it just healthcare? And so I think my scope, my interest really kind of laid beyond just the healthcare system, but really to address what are kind of the social determinants or other factors that impact people's lives. And as you may have heard, as Jeff alluded to before, is that, place matters. And so if we think about why we keep treating people for illness and only to send them back to the conditions that created illness in the first place, we see that, education, transportation, safety, violence, food security, poverty, all has a huge impact on health, more so than just getting access to health care. And so that's really what inspired me to go back to graduate school. I actually started out in the MPH program, and then a year later I petitioned to add on the city planning degree. So I actually didn't apply for the dual degree at the start. So from there, where I'm at now at the Center for Care Innovations, it's really through the networks and relationships I've built as a result of the two programs. And so I knew that, I wanted to influence the healthcare system to really focus more on population health, but I didn't want to be in a healthcare system. I thought about, well, is policy a place I wanted to be in, or philanthropy? And so I actually went down the philanthropy route. And I got to intern at the California Healthcare Foundation for a bit, where I met my current executive director. And so I realized in the philanthropy world, there's more flexibility and room for innovation in terms of what we get to fund and the types of programs we get to build. So at the Center for Care Innovations, we partner with large foundations such as the Shield of California Foundation, the California Endowment, Kaiser Permanente Community Benefit, to really explore new models of transforming care and really understanding the patient's needs, which means that we need to broaden our focus to not just look at, how do we get more people into the system, which is very important, but how do we keep them healthy? So, which means, they'll need to partner with leaders from other sectors, which I think is where the city planning degree really kind of lends itself, because in that program, I got to learn, other skills that were complementary to the public health program. So in the public health program, I was in health policy management. So I definitely gained the skills there. We learned about negotiation, strategic planning, finance, just learning about the healthcare system and, the delivery and quality and the insurance system. And then on the city planning side, I wanted to bring in the lens, a more kind of visual, kind of spatial lens. So I got to learn how to do GIS mapping. So really looking kind of on a broader scale of like, where are the patterns of poor health, and in a neighborhood that's stricken by poverty, like what are the other factors and players in there that we could potentially partner with to really help improve population health in that area. So there's GIS, and then also other methods that urban planners and architects use is something called a charrette design meeting, where they get the input of key stakeholders in the local area to map out the solutions, map out the challenges, opportunities, and solutions, so that you really get the voice of the populations that you're serving and that you're designing for. Often in healthcare, some of the, most of the decisions can come from the top down, but what we're trying to do is create a more collaborative opportunity and space for not just physicians, staff, and leaders, but residents, patients, and other key partners to be a part of the process. And so, yeah, so that's kind of like in a nutshell. I know I kind of jumped around, but trying to tie together kind of the narrow focus to a more broader lens, but still addressing the critical kind of issue and topic of health. So yeah, with that, Sunny, any other leading questions? I'm sure there are other things that I haven't covered.
Okay, well, I want to entertain a question by Marin on here. The person has a question for you directly. How is your experience applying to the MCP program while being an MPH student versus coming in as an MPH, MCP concurrent student? Is adding on another degree common, or is this petition process something that's done rarely?
Interesting. So, I mean, when I petitioned for the degree, I was in a cohort of 4 people, and since then I know that dual program has grown significantly. I don't know the exact number, so I think it's getting more competitive. So I think the petition process was very, from what I've heard, is much, and what I know is that it's much simpler than applying from the get-go, because when you apply, you have to do the full application for both schools. And for the petition process, you just submit kind of, a simple application form, 1 letter of rec, and then your personal statement. So I think it's a simpler application if you petition, but for UC Berkeley now, I know that the program is becoming more popular, so it might be more beneficial to apply from the start. And that's not to say that, you know, let's say that you didn't get in the first go-round and then you decide to just do the MPH. I mean, I think there's still a possibility during your time there to petition or to build a relationship with a faculty member who you might want to work with and then go that route. Yeah.
Okay, a question that someone posed was, how did you work while you were in graduate school? And if so, like, how was that process?
Oh boy, I did work while I was in graduate school. There were some times it was very difficult, and other times, you know, I was like, I'm glad I'm getting this experience. So in the dual degree program, you have, so you're there for 3 years, you have 2 summers to do internships. The first summer, I did an internship at Kaiser Permanente Community Benefits in their national office, and I extended my internship maybe like 5 months after, and I made the choice. I actually terminated my internship early because, you know, my workload was just, you know, becoming too much, and so I made that decision, and they totally respect that and understand. And so I think it's worthwhile for sure to work while you're in school, but just map out your workload, because in a dual degree program, I mean, you have, you know, you just have a lot of classes, and at that time I was starting to work on my capstone and my thesis, and so I was just juggling too much. So yeah, just definitely look at your plate and really ask yourself if it's something you can handle. In terms of the work experience, though, I mean, what you gain, I mean, the people that I've interned for and that I've met with Kaiser, I continue to partner with them today. So through Kaiser, I met folks at the Innovation Consultancy, which is their in-house kind of design and consultancy shop, and the Center for Care Innovations, we partner with them very closely in one of our grant programs. And so those connections that you make really go a long way. And so when Jeff says, like, network or not work, I remember when I first heard that, I was like, oh, what do you mean I'm not good at networking? Like, I'm really shy. But, I mean, now I rely on my network and my relationships, like, more than ever. And so definitely keep that in mind. You know, look for organizations that will interest you, leaders that you want to, you know, do information interviews with, that could be potential mentors and things like that, because it'll be beneficial for you in the future.
Okay, another question for you is, how long did you work before coming back to graduate school? Because you said you did your undergraduate degree at Berkeley. How much time did you take off, or did you just come right into the program?
I took off for 4.5 years. I actually, initially I was only going to take a year off, but you know, life happens, and I moved back to LA to take care of my mom for a little bit, and so I knew that I was going to go back to grad school. I just kind of like let that time come on its own, but I did stay in the workforce for 4.5 years before coming back, which is, I think, is a little bit longer than most people might take, but it really varies. Some people stay out for 8 years, some 1, and some go straight. But I mean, from my perspective, I think having work experience before going back to grad school is a huge benefit, because you bring in that experience and perspective into the classroom and discussions, and you know, the people you meet who also, you know, some have work experience, some don't. It just adds like a more rich dynamic to your experience in grad school.
Okay. Another question presented to you, because you did say that you did UC Berkeley, you went there undergrad. A lot of students ask me a lot of times, who are Berkeley students, we went here undergrad, I don't want to go here for graduate school. So did that ever pop into your mind? Why did you decide to come back to Berkeley if you already were here for your undergrad experience?
Yeah, funny you asked, because I was actually considering going to UCLA's School of Public Health, and I remember, so I went to UCLA Spring Visit Day, met with like an awesome faculty member who is now a faculty at UC Berkeley School of Public Health, and then I went to Spring Visit Day at Berkeley, and you know, I've known Jeff for a long time, and the Director of Diversity, Abby Rincon, and so I remember that they both ganged up on me and they said, Rosa, you're choosing between Berkeley and UCLA? You know, I mean, they were joking. And, you know, at that point, I realized that I have a community at Berkeley already, you know, who's looking out for me, who's going to invest in my future. And, I mean, I love the Bay Area. I started, the company that I worked for, Pacific Business Group on Health, was in the Bay Area. And when I moved to LA, I actually worked remotely and I flew back and forth. So a lot of my ties professionally were in the Bay. And so it made sense, even though, you know, initially I thought, like, oh, I just wanted to change the scenery. But once I started grad school in Berkeley, I soon realized that it was a completely different experience, mostly because now I was out of school for 4.5 years, so coming back, I was just coming back as a person in a new phase of my life, and just the grad school experiences versus undergrad, I mean, you don't really feel like anything's redundant other than the fact that you're on the same campus, but you know, you have a sharper kind of focus on what you want to get out of it, and grad school is really focused on I think not just the academics and building the knowledge base and the skills for your career, but the networks and the relationships, because, I mean, that's what you carry with you beyond grad school. So I think there was definitely more of a focus, that community focus that I was looking for, and I don't regret it one bit. So I'm glad I came back to Berkeley.
Okay. Last question for you is, what one piece of advice would you give to a student thinking about applying to the joint MPH-MCP program?
One piece of advice is be proactive about doing informational interviews with, one, faculty members at schools with, you know, the dual degree that you're considering, and two, with alumni and current students, because I mean, it's one thing to just do research on, like, oh, this looks like a cool school and it's in a great location, but you want the scoop. You want the good, the bad, and the ugly, especially from folks who are currently experiencing it or who have gone through the program. And then also, I think it's important that you identify, you know, a research interest or an area of interest that you're interested in exploring further based on, you know, I still do this today just to, you know, continue to build my connections, but look at faculty profiles, see what organizations they've been affiliated with. I mean, because ultimately those connections could lead you to a career, and where I'm at today is through, you know, the places that I've worked, the relationships that I built, and I, you know, leverage that and definitely be proactive about talking to people, not just doing research in the school on the web or anything, but going out and talking to people. That's the one piece of advice.
Okay. I lied. I have one last question. I'm so sorry for lying. The question is, have you been able to use a lot of your master's in city planning training and your master's in public health training on your job, like both of them? Have you?
Yeah, interesting. So I use more of my public health training, I would say, because the organization I'm at, where we support safety net clinics, public hospitals, so we work with healthcare organizations. I bring a city planning lens to it, so I alluded to like GIS mapping. We don't use it extensively here, but to look at the distribution of grantees, where there are opportunities to reach out to support other clinics in, you know, low or underserved areas. But what I'm trying to do is kind of what I call agitate the system to help bring in a stronger lens to really get at what Jeff was saying is, like, you know, to build healthy communities. So what we've started to do is explore opportunities to partner with, like, the city of San Francisco, who's interested in our work. They have their own Office of Innovation. They're looking at how can we work with the healthcare system to link, you know, residents and patients alike. Cities call them residents, health systems call them patients, to the services that they need that span across healthcare and social services. And so I think it's starting to happen because this is becoming more of a priority, especially with healthcare reform and, you know, skyrocketing cost of care, is how do we really pay attention to the needs of the patient that go beyond the walls of the doctor's office. So I think there's some promise, but when I first started here, it definitely wasn't something that I was using, but as Oliver said, you know, any experience or degrees or anything that you bring into the work that you do moving forward, definitely leverage that, and it might come from some place totally different that you think doesn't connect, but I think it'll serve you well, especially in our society now. You know, another note that I wanted to point out is that, you know, for organizations today, they're looking for leaders. I think what's highly valued is, you know, leaders who come with an interdisciplinary perspective. If you look at Kaiser's Innovation Consultancy, on their team, they intentionally look for people outside of healthcare. They have an industrial designer and an architect on their team. They have a brand strategist. They have an engineer. They have an interaction designer. And this is why Kaiser is seen as one of the most kind of high-performing health systems in the world. Is, you know, they have the resources, but they intentionally structure their organization to be interdisciplinary. So I think if you're choosing a dual degree, you know, definitely consider that.
All right. I want to thank you, Rosa, for taking the time to join us. I want to let folks who are on the line know that with the last 10 minutes at like 6:20, both Rosa and I will entertain as many questions as possible. So continue to send your questions in through the text box. So thank you, Rosa, for taking the time out of your busy schedule to join us today. So I'll move.
No problem. My pleasure.
No problem. All right, so I'll move on. And for those on the line who are interested in a social welfare or social work degree and journalism degree, unfortunately we couldn't get panelists on here to talk about those two different degree programs, but I can talk about them a little bit more if you'd like that. I did work at Berkeley doing recruiting and outreach, so I know a little bit about those programs. So I don't want you to feel bad if we don't have panelists on here for those two degree programs. But as I said earlier, my name is Sonny Bernard. I got my degree in public health and public policy at UC Berkeley. I actually come from the East Coast, so I'm not a Californian at all. I'm originally from Long Island, New York, and I did my undergrad in Philadelphia and Pennsylvania. And my background was actually in business. I studied accounting and economics. And to be quite honest with you, I'm a first-generation college student, so I didn't even know what I wanted to do in life. And the way that I kind of got into accounting, it was just by luck. I'll never forget it. I was sitting down with my career advisor, and like I said, I didn't know what I was doing. And she sat me down, and she said to me, "Sonny, you're going to have to pick a degree program." I'm like, "You're going to have to major in something." And I didn't even really had a conception of like what that even meant. And then she opens up a book, and she was going in alphabetical order, and she starts off with accounting. And I'm like, okay, cool, I'll do that. And that's how I kind of like got into accounting, like haphazard like that. But fortunately for me, accounting is a very secure degree. If you graduate with an accounting degree, you can get a job. So even though I didn't know what I was doing, I was fortunate in that I picked a good major to major in. And as I was going through undergrad, I majored in economics. So I knew that I wanted to, as I was in undergrad, I knew I wanted to do something with business, but I didn't know like in which area. I was still a little confused. And then in 2005, one of my friends sent me an internship package with a ton of opportunities. And one of the opportunities there was at the University of Michigan School of Public Health, their summer enrichment program. And that's how I got exposed to public health. It was by accident. I was just a broke undergraduate student just looking for a way to make money, and then my friend sent me this opportunity, and I applied, and fortunately I was one of like 16 students out of a ton of applicants who got into this program at the University of Michigan, and it was one of the best experiences in my life. If it wasn't for that program, I wouldn't be here today. And so after I completed that program, I knew I wanted to do public health, but I was already a double major in undergrad, and I didn't want to be like a super senior and add on 3 majors. So I told myself after I graduate, I'm going to do something with this accounting degree. But after 2 years, I'll do accounting for 2 years, then I'll return back to graduate school. And then that's what I wound up doing. So I was a financial auditor for 2 years at a company called KPMG. And if you're not familiar with a financial auditor, these are the individuals that go into different businesses and making sure what they record on their books or their financial statements are actually the truth. So in essence, I'm trying to stop the Bernie Madoffs of the world and making sure that if you're investing in a company and they're saying they're making money, that they're actually making money, not lying to you and swindling your money. So I did that for a couple of years and came to school. And very similar to Rosa, I came in as a public health student. Like I came in to the health policy and management program. I didn't know anything about public policy at all. But one of the things at the School of Public Health at Berkeley, if you're in the Health Policy Management program, you have to take a required health policy class. And inside that class, it's students who are just public health students, it's students who are public health and public policy, and students like Oliver who are MPH MBA students. And one of the things I noticed is that in that class, like a lot of the MBAs, because they're trained in economics and business, they use a lot of economic jargon, and if you're not familiar with it, it's very intimidating because they sound very confident when they're saying what they're saying. And so like a lot of my MPH folks were a little quiet in the classes. I'm like, that guy over there didn't even say anything. And what I did notice is this one girl who would always be arguing with the MBA, MPH students. And I decided, let me find out where's she from. I want to do what she's doing. And her name was Allison. And Allison said to me, Sonny, I'm in the public policy program and the public health program. I'm like, oh, okay, that's cool. And then what I found out, like Rosa found out, is like once you get into the School of Public Health, you can then apply to different degree programs, and public policy is one of the degree programs that you can do. So what I did was, coming in during my fall semester, I decided to visit the public policy school. So everything that Rosa said is so dead on point. I decided to meet faculty there. I sat in on classes to get a sense of what life would be like as a student in the School of Public Policy. And also another interesting thing for me at the time, because like I said, I'm an East Coaster, coming to California in 2011, specifically to the campus of UC Berkeley, was very eye-opening for me because it's when Occupy was going on. So me with my East Coast brain coming to California and expecting Berkeley to be radical, there was a lot of protests going on campus. And so that got me like really excited. The activist in me got super excited. And the thing about graduate programs is that they're very fast, like typically 2 years, and that flies by super quickly. So that was also another thing for me, why I decided to add on another degree program, because it's just 1 extra year. But it also gave me a lot of time to really think about what I wanted to do. So I applied to the public policy school, got in, and then the next year I did my classes at public policy, and my last year I did a mix of public policy and public health classes. So after graduating, I worked at UC Berkeley helping to run their summer Health Careers Opportunities Program, HCOP, and it's a program working with underrepresented students in graduate education and teaching them professional development skills and training, also helping them how to design a research paper, and having students also work with faculty members and all that. So it was a great experience for me, and currently right now I'm doing consulting work for my HCN. So me personally, I love outreach. I did outreach and work while I was in graduate school, and for me, like the training that I picked up in public health and public policy has definitely been very helpful. In the public policy school at Berkeley in particular, there's a very strong emphasis on quantitative analysis. So you do a lot of economic statistics and all that, and I've actually been able to use all that in my outreach work. So we go to different campuses for Berkeley because we want to get like more diversity at our school. We visit different campuses all throughout California, and we want to know like how effective our outreach is. So my bosses would give me a ton of data, years of worth of data, to see like how effective we've been on the different campuses. Or maybe we're spending too much time on one campus and another campus needs more help, and so forth. So going through that quantitative training, like really learning statistics, was very helpful for me. And at the public policy school, they really beat you down with math. And it's been helpful for me. And I'll be the first to admit that statistics was the scariest thing for me. But working with my classmates and also spending extra time after class, because there are a lot of resources to help you, was very beneficial. And I actually understand some of the statistics stuff now. It only took me 4 classes to figure out like what I'm doing, but I'm so beneficial to the programs. The programs have been super beneficial to me, and I see me still using a lot of the skill sets that I picked up while in graduate school to this day in the current work that I do. So with that, I'm going to start answering some of the questions and also leave some time. We're going to leave 10 minutes at the end to start answering, to answer all your questions, both Rosa and I. But let me Let me start off with Carol, who asked me what I'm ultimately hoping to do with my MPH and MPP degree. And Carol, that's a very great question. I'm a little different than most people who decide to get an MPH and MPP degree. Most people really want to do hardcore health policy work. But as I said before, I've been doing graduate outreach work for the last 2 years since I've been working at Berkeley, and it's something that I'm very passionate about. So public health is all about population health. And public policy is like proving that things work, using quantitative analysis to prove that different policies are working. So what I've been able to do is intertwine like my public health and public policy training to help me get there. So I use that stuff in my policy work. I want to see like more diversity at our schools. One of the things that was surprising for me, like coming to Berkeley from the East Coast, is we have done better in terms of diversity, but it's not as great on the graduate level as I expected it to be. Since our diversity director has come to the School of Public Health, it used to be 5% underrepresented students. Now it's up to 25% of students who identify as underrepresented students, which is a huge increase. That's a 5-time increase, but there's still more work to be done. So I want to work and find effective, proven policies and proven ideas to help shore up those numbers. So that's what I'm hoping to do with my public health and public policy degree. Continue to do the outreach work and getting more diversity into our graduate schools. Because as you're well aware that the demographics of this country is changing, so we need people out there who are giving culturally competent care. And not only that, we want people who understand the communities that they're working with to design the policies. I don't want somebody who's not from my community making policy decisions for me. You ain't from here, So that's how I feel. So, so that's my thing. I really want to continue doing the diversity outreach work. So, next question is from Marlene. Do most graduate students finance their 2 years graduate school with loans? Would you think there are enough scholarships out there or through Berkeley specifically to provide a full ride? Marlene, I think that's a fantastic question because I think finances, if you think about it, it ties into public health. Because there's no way that you can sit easy at night going through school and knowing that you have $100,000 worth of debt. That's stressful in itself. That could ruin your health in itself. And me personally, the reason that I decided to come to Berkeley, and what I think is really nice about, I think that you guys are very fortunate here in California, is that you have so many outstanding schools here in California, outstanding public schools. So you have all these UCs that are top ranked, all these programs that are top ranked, so you can take advantage of the in-state tuition, which is a great thing. And I could speak for UC Berkeley and UCLA a little bit, is that one of the beautiful things about coming to school at one of these institutions is there is opportunities for funding. Our big thing is here, we don't want you to go broke to go to school. That's not cool with us. So there are opportunities to fund your education. There are scholarships available, but they're very limited. As you can imagine, there's a lot of students who need funding, and then there's very limited amount of funds to go out to everyone. But there are other opportunities to fund your education if you don't get a scholarship. One of the things that UC Berkeley specifically is the graduate student instructor position, or a GSI. That's essentially being a TA for a class. So if you may have majored in sociology and you think that you'd be a good candidate to teach an undergrad class, to help a professor teach an undergrad class in Soc 101, you can do that. You can do that. You can reach out, and depending on how many hours you work, it'll cover your tuition, and plus you'll get a salary on top of that, a monthly salary on top of that. Maybe you're saying to yourself, Sonny, maybe I don't want to work with students. Maybe I don't like people. And that's fine. If you don't like working with people, that's cool. You can do, there's also graduate student researcher positions where you can work with different departments on the campuses and work on research with a professor or a particular department. And depending on how many hours you work doing that, if you work about 20 hours a week, that should cover your entire tuition, and plus you still get a salary on top of that. So there are opportunities out there to fund your education, and if you want to know a little bit more about that, I definitely say to reach out to me at sunnyv2007@gmail.com. That's sunnyv2007@gmail.com. And because I worked at the School of Public Health, so I know all about the different ways to finance your school and education. Okay, and I'm going to turn the floor, I'm going to open up to questions for both Rosa and I. And one of the questions that we have for Rosa in particularly, Rosa, are you still on the line?
I'm here.
Okay, one of the
There might
questions.
be a lot of background noise, but I'm here.
Okay, cool. One of the questions for you is like, what are you ultimately hoping to achieve with your concurrent degree program? Concurrent
That's a great
degree.
question.
Yeah.
Yep. I could be, I mean, 30 years from now, the answer could be very different. But I know definitely in the short term, you know, reshaping how we do grant making in healthcare is what I'm really focusing on now, especially with the notion of building healthy communities and, you know, funding and supporting collaborative networks with not just healthcare systems, but with other sectors like city government and education, because they all have a stake in how healthy a community is in terms of, you know, how they serve them and the programs and policies that they create. And so I think that's really my focus. There are foundations that work on that already, like the California Endowment, Kresge Foundation, I believe in Michigan, Robert Wood Johnson Foundation is really, they changed their whole direction to building a culture of health. And so I think it's moving in that direction. And so I'm hoping to see that more in California at where I work. So I think just leveraging my city planning degree to be able to really move our organization in that direction, which is a huge challenge, of course, you know, and grad school doesn't train you for that. But I think it's like it's really exciting to keep that in mind and to try to push that forward. So that's what I'm going to try to do during my time here.
Cool, great response. Another question that was posed was, one second as I go through the chat dialogue. What was the toughest thing for you to manage in school? And is that challenge the same for you in school as it is in work right now? Is it the same challenge?
Hold on. Can you repeat that one more time?
What was the toughest challenge for you in graduate school? And is that challenge applicable to you in work right now? So is it the same challenge that you had in school? The challenge that you had in school, is it the same challenge you have at work right now?
Yeah, that's a great question. I mean, the first thing that comes to mind, I'm sure there are other things, is, I mean, it's kind of around like time management and prioritizing, because I feel like my plate is constantly full. I mean, in grad school, of course, that was the case, juggling multiple papers and projects and classes. But where I work at the Center for Care Innovations, we're a small team of like 7 people. So we really function like startup nonprofit, and so we all wear multiple hats and support each other in various ways outside of our own scope. So I'm constantly feeling, I constantly feel that of like, how do I not get burnt out? But, you know, love the work, and so that's what pushes me forward. And so I think that's a struggle. But another thing I wanted to point out, I mean, in grad school I didn't really have this challenge, but I think an important challenge that I realized in the workplace is managing up. And Jeff talked about this too, and I think there are some webinars around it, but how do you manage your manager in a sense? Because sometimes you might work in an organization where you don't get the support you need in order to be effective or successful at your job. And so how do you essentially manage your managers to make sure that you get the resources and support you need? And that's a whole other thing that I'm still learning, and it's going to be an ongoing process, but I think it's good to keep in mind as you think about careers and the workplace and the type of organizational culture you want to be in.
Okay, I have another question here for you. We can both answer this. Is how do you feel about some comments of being overqualified or organizations not knowing what to do with you because you have two degrees?
Huh. Can you repeat the question one more time? I think I got it, but I just want to make sure I digested it properly.
The question is, how do you feel about some comments of being overqualified or organizations not knowing what to do with you because you're a rock star and have 2 degrees?
That's an interesting question. I know in my situation, it's more where I landed my job was based on, on the relationships that I've built at previous jobs. So it's mostly for me, it's like it's a stepping stone and ongoing professional development to carry on the skills that I gain here in my next endeavor. But I mean, I get what you're trying to say with, like, because I honestly do feel like I'm underutilizing my city planning degree, and I could be at another place that really leverages both. And so, I mean, I don't have a straight answer for that. I mean, I feel like there's still a fire, you know, under my feet to not be complacent and just be like, all right, well, I landed a job, and, you know, and that's it. But I think what really drives me are the issues that I care about and that I sought to explore more deeply when I started the grad school program in the first place. Because, I mean, I miss the excitement of being in an academic setting and in a classroom where we get into debates about issues that we don't really talk about in the boardroom in the same way or in the work setting, because you're dealing with a whole host of other issues and priorities and administrative barriers that really get in the way of giving you that kind of mental freedom to explore and question why things are the way they are and to make real change. And so, yeah, I feel like I got to do something about it at some point. So that's what I'm keeping in the front of my mind.
Okay, well, I'll answer this next question. And Caroline, I'm sorry if I don't answer in detail. We're running a little short on time. But your question to me is, like, what public health differences do you find between California and the West Coast and the East Coast? For me personally, it's pretty much the same. Like, I haven't seen, like, any differences. I think we both have challenges, specifically when it comes to men of color, not being in college and not being able to get to graduate school. We have people who aren't accessing insurance at the rates that we want them to do to make sure that they maximize their health. We still have disparities in healthcare. So I think the issues are still the same. One of the things I do notice about California is that one of the cool things about it is, like, everyone is kind of like watching California. I noticed that about California and New York. California is I'd say this, they're very innovative, and they're really interested in trying out new policies. So it's a great great policy lab, so to speak. So you'll see a lot of, like, innovative work being done out here. So I do see a lot of proactivity, specifically here in the East Bay, so the San Francisco, Oakland area, Bay Area. So yeah, I think the problems and challenges are very similar. The prison industrial complex, disparities in diabetes care, all that. I think it's all one and the same, to be quite honest. I haven't seen any differences in the public health challenges, so to speak, and that's my personal opinion. I don't know if you have any thoughts on that, Rosa.
Differences between states, you mean, or?
Well, public health, differences in public health challenges between the East and West Coast.
Oh, yeah. I concur with your response. I don't know if there's necessarily any differences. I'm sure if you take, like, geography or just neighborhood composition into account and the percentage of people in poverty in certain pockets of the state, there's going to be variation, but I think at a high level and overall, the issues are the same. You know, they affect us nationwide in terms of chronic, you know, the rising burden of chronic disease and trying to curb healthcare costs and things like that.
Okay, cool. Awesome. Well, thank you so much for spending time with us today. We're getting closer and closer to 6:30, so we're going to wrap things up, like, real quickly. I want to say that, unfortunately, like, we didn't have anyone in social welfare and journalism, but if you want, definitely reach out to me, and I can connect you to people in those programs if you're interested. My email address is sunnyv2007@gmail.com, and you can find it in the chat text box. And one of the things about public health that's beautiful, you'll hear people say public health is everything, and you're starting to see more of that, because, like, public health, if you're going to work in public health, you have to work in business. You can have the greatest idea ever. Maybe, for instance, you want to feed every kid in a particular country, and that's great. That'll definitely improve their health, but how are you going to do that? Where are you going to get the financing to do that, right? So it's very important for public health to talk to business. There's also public health and social work. I was speaking to my friend earlier, and she was saying that how she's been able to use her public health and social work degree, whereas public health is more focused on population health. She says she likes the fact that she gets to do direct practice, like, with individuals, because social work is more one-on-one, whereas public health is like, how can we raise up the population's health? So she gets the balance in between the different worlds. So she gets to do population health type stuff, and she also gets that one-on-one interaction. So public health and public policy, public health and journalism. So you'll see a lot of those combinations. There's also public health and MD degrees. So you'll see more and more of those sprout up. So definitely continue to check out myhcn.org to follow up with more of the webinars that we're having. Next week we'll be having a public health and clinical careers option webinar. So if you or anyone you know is thinking about becoming a doctor, but you also want to have that public health training to complement your medical degree, please join us next week at the same time. And so just be on the lookout in your inbox. And I want to emphasize this. Don't be shy when it comes to sharing this information with folks that you think can tremendously benefit from it. We're here to help you and your friends and family try to figure out their authentic health careers. So please forward our emails over to anyone you think that would benefit from these webinars, and encourage folks to check out the myhcn.org website. So with that said, have a great night. And I'll be posting this webinar on the website, on the myhcn.org website, within the next day. So if you have someone who missed it, they can watch it online as well. So I want to say thank you for your time and have a great night. And for all questions that were unanswered, please email me and I'll answer them in full detail. Unfortunately, time is up. So have a great night now. Thank you.
Thanks, everyone. Bye.